Hi everybody, my name is Rhys Barber. I'm the audiologist here at Audiology Associates. We upload new earwax removal videos every Monday, Wednesday and Friday at 9 PM UK time, so please consider subscribing. I thought we'd start today's video just to give you some idea of the size of the tools we're going to be using. This is the fine end, so you can see it's only about 1 millimeter thick, so just over a 1/16 of an inch as well. This patient's come through with a very narrow ear canal, feeling very blocked up. You have actually seen the other ear being cleaned out in one of our previous videos, but this lady we had to get it back in just to finish clearing out this side here. So what you can see is we're having to hold the canal open using the fine end, which will just allow us enough access then to get in here. The reason there's little bits of wax on this fine end already is because, as I said earlier, we'd already cleaned out one ear, which you've seen in the previous video. So we're just going in and taking away some of the softer pieces of wax that you can see here. So we're working across the bottom of the canal first of all, just to take this away. The patient had come through, normally been seen by the ear, nose and throat consultants, but it's a bit of a difficult situation here in this part of the UK at the moment, because it's very difficult to get in front of the consultants to have earwax removal done in this particular area. So there's a very lengthy wait and people are getting lots of postponed appointments. So this lady has had a build-up for quite some time, hasn't been back to see the ear, nose and throat consultant in well over a 12-month. So what we've got here is lots of bits of skin and wax debris sitting about 2/3 of the way down the ear canal, blocking up that canal completely. So very reduced hearing, no discomfort or anything here. Just gently removing some of the skin debris first by peeling along the canal wall. The difficulty you have when you use a much smaller end, as you could see from the video at the start, how fine this fine end is, it just means that when you're suctioning much softer debris, such as this is here, it blocks the end of the suction tube very quickly. So what you tend to find is you have to be going in and out of the ear quite a bit and clearing the end of this tube. So what we can see we're doing here is just holding on to a bit of harder skin material that we're just trying to take away there, but you can see that it's held in quite tightly, so it's still attached to some of the canal walls a bit further in. So we're just trying to break this down very slowly. Lots of in, out of the ear because we're having to flush this tube through. If you imagine if you suck smaller debris inside the tube, what happens then, sometimes it coats the inner of the tube. Now if you're using the standard size on the tube, you can push like a little cleaning tool through it just to clear all that out, so you maintain the suction. But with this fine end, this very, very small type of tube, it's very difficult to do that. They don't have a cleaning tool that's small enough, unfortunately. So just working our way slowly around this canal wall at the moment. You can see that we're trying to break down the edges of this wax. And this bit of skin, there was another piece of skin coming away there. This is what proves difficult with these much deeper type of wax issues, is you do tend to find you get sometimes a lot of skin debris building up down here, especially in narrow ear canals. So it's trying to maneuver this out and trying to hold enough and get a strong enough grip on here using a very, very small end. If we were putting the standard size ulnar tube in here, if the ear canal would accommodate it, then we'd be able to suction a lot of this straight into the tube, so we could just keep going and working our way very slowly down. But what you find with this type of ear canal especially, if you notice the next time we go into the canal, the skin on the outer part of the ear canal is very flexible, so very loose. So as we go in, if you try and go in with the standard size tube, you can see it's getting sucked into the sides there. What would happen is when you put the standard size tube in here, because the entrance is so small, it would actually collapse the outer part of the ear canal, which would form a perfect vacuum around that tube. So what you get then is it's really uncomfortable, because if you imagine having a sudden pressure change in your ear, that's what it would feel like. So it can be quite uncomfortable for the patient. So you've always got to be mindful, although a larger tube would be more effective against the wax. It's also going to be more prone to giving the patient a lot of discomfort. You can see just how much it's collapsing, and this is only 1 millimeter wide, remember. It would cause a lot of discomfort for the patient, and you've got the potential then of causing bruising or bleeding to the eardrum, especially if there's a sudden pressure change there. So we're working down to the last few pieces. So what we did with this patient is we told them to go away. After that, that was the last of the first visit there. Pop some olive oil in there just to really loosen and soften the skin debris closer to the eardrum, because that's going to help us to remove it and be able to pull it away from that deeper part of the canal more effectively and more comfortably for the patient. So what we'll see first of all, you can see this is what we were talking about the skin sometimes collapses down. This is only 1 millimeter wide. Now you can see the gap is still open there, so that it's not going to cause that vacuum effect, but you can see how difficult it was just to get the fine end in here. Just taking away this looser skin debris to the left hand side first. You can see it's just peeling down the canal. There we go, just peeling away. Just working our way down. There we are, there's another piece of skin there. On the first visit, we actually went through 5 fine ends on the first visit because it just kept blocking so much, and you can't unblock the fine end. We're having to constantly change it all the time. And what you'll see with this one now is we're just pulling on that skin debris in the top portion of the canal. There you go. See, it's coming away now in bigger strips because we've softened it. If you imagine moisturizing your skin, it just helps to keep it soft and supple. And that's what's going to happen with the skin debris that's in here. It just helps to soften it, makes it that little bit more supple, so you're more likely to be able to peel pieces of it apart and be able to get into that deeper section. Obviously with this type of suction where it's very, very narrow ear canals like this, you're constantly checking in with your patient, making sure they're feeling okay, there's no discomfort there. You have to be very careful with the angle as well that you're using as far as the tools are concerned, because if you imagine as we go into the canal, you've got straight tools, you've got the endoscope, you've also got to accommodate the suction tube in there as well, and you're trying to work around corners and bend and guide these tools down into deeper sections of the canal, but you've got very little opening at the entrance to the canal. So if you imagine we'd normally move to maybe left or right, which will alter the end position of the suction tube, very difficult to do that in a narrow ear canal. So you tend to stick to the edges, to the center as much as you can, because the edges are a little bit more difficult to get to without causing some discomfort for the patient. So get into this very kind of soft, slightly thicker and stickier debris now. Just that little bit deeper in the canal. You can just start to see the first glimpse of the eardrum now. The bottom right hand corner of that debris, you'll see a little touch of blue. There you go. There, the bottom corner there, you can just see that that's the eardrum. So you can see how close we're working to the drum now. The skin in this part of the ear canal is very, very sensitive. So very sensitive to touch, including the eardrum as well. So really trying to stay in the center of this. You can see the skin, what I mean about that loose skin collapsing in there. So just trying to stay in the center of this block as much as we can. We can see a little bit of movement there, but this right side is holding it in. So I'm going to have to work to the edge here just to pull this into the center. There we go. Loosening that edge off. So back in again. Sometimes what you can do with very narrow ear canals like this as well is if you find it's constantly collapsing like that when you first go in, what you can use is the endoscope itself to hold the canal wall open. If you're using slightly different tools, if you're using things like loops to look into the ear canal, you can normally put like almost like a spacer in so it holds the canal open, but you have to hold that with one hand. And obviously when we're using an endoscope and a suction tube, both hands are full, so you can't really put anything in there to hold this open effectively. Okay, just working our way down very slowly. So we're starting to clear the right side. The bottom's detached now. So we've got this lump of wax there. As this is coming away, there you go, just taking the top section away there of it. So what's on the surface. You can see this whole thing is starting to come away now. We just need to detach it a little bit more from the top. There we go. Now we're starting to see a bigger chunk of that eardrum exposed. I don't think this wax has actually touched the eardrum here. I think we're sitting just in front of it, which is a good thing, because clearing wax off an eardrum in this small space is very, very difficult to do. Very difficult to do. So you can see we're just pulling on the top section there. Quite frustrating at times, because you think you've got a grip on the wax and a little bit will break off and instantly you've lost suction on the tube. It's just clogged straight away. Aiming for this bottom left to detach, trying to hold on to it. There we are. Just start to see a little bit more movement to that bottom section. Now it's coming away from the eardrum a little bit more. Let's see if we can grab this. There we go. Starting to come away. Lovely. So we've getting that piece coming away there as well. Just a little bit of wax broke off at the entrance to the canal, so we'll just clear that bit. There we go. So just get rid of that bit there. You can see having to kind of push the skin apart to get back in again now. Right, so there we are. We've got the eardrum there. You can see that about 2/3 of the eardrum exposed. Just try to loosen this top section there. Now we're starting to see a big chunk pulling down. There we go. I don't know why I get quite excited. Obviously, I've sat through this, but when you look back over it, you do get quite excited when you see parts coming away. So we're just going to get this next section. There we are. It's just sitting at the entrance to the canal. So we'll just hold the suction there, wiggle it up and down, which just helps to break it down in the entrance to the canal. There we are. Just opening this canal back up again. There we go. So we can see the majority of the eardrum there now. I can see, well, actually I think we can see all of it now. We just got a little bit to the left hand side here, just a bit of loose wax along that canal wall there, and there's a piece up here in the top right corner there, so we'll just try and grab that. Very difficult to try and get the tools up into this position, and just because you've got very little room to play around with there. Okay, and there's the eardrum, looking nice and healthy. So this is what it looks like, a small amount in here, but when you look at the size of the ear canal, you can see it was large in proportion to the size of the canal. Thank you very much for watching our video today. If you did enjoy the video, then please like. If you're not subscribed already or you'd like to do so, you can click the subscribe button here. If you'd like to check out some more of our videos, they're also up there. Now, if you want to follow us, you can do on Facebook, Twitter, Instagram, and also check our website if you want to know a little bit more about us. As always, guys, until the next time, take care.